Welcome everyone. Today we have another new episode and we're going to discuss about this healthcare and healthcare related things. My friends, Mr. Alex, he is doing a lot of works as an activist, specifically for climate change. In the climate change situations, actually, we have to handle this healthcare system as well. So he going to introduce some interesting points uh, based on the healthcare system, and he has expertise on climate change. So what's going on in the future? We're going to learn from Mr. Alex. So hello, Mr. Alex. How are you today?
Yes, I'm good. Thank you. So again, I'm here this morning. I love Sharif's program. We're reaching so many people with important knowledge. Reaching out to experts and professionals around the world. I will give my personal opinion and some of my expertise regarding this, but I am not a healthcare provider. But I will describe some of the things that I see that there's room for improvement. So with some of my background, I have taken all of the Red Cross courses, which I'd highly recommend for anyone getting started in disaster relief or possibly the medical industry. I've taken the EMT course and I loved that course. Just all the information, the knowledge, learning about the human body, how to help people. And I've taken a variety of different courses that almost relate. So today's topic is about healthcare and healthcare improvements. And of course, there's so many healthcare improvements that we can do around the world. So in 1986, there was the Healthcare Quality Act that was initiated, but I'm not going to go too much into that. One thing that I do want to talk about is quality improvement. So quality improvement is something that any hospital or healthcare provider can incorporate into their existing infrastructure in their hospital, into the work area. So quality improvement is a model that's been duplicated from they use this in different industries, different companies and corporations, major companies around the world. They use quality improvement and the platform of quality improvement to, most companies and corporations to make more money. In the healthcare industry, it's to hopefully, and I would hope to trust that it's to improve the quality of the care the patients are receiving. So quality improvement also goes by QI. So as Sharif just brought up this image is the some of the steps that you take to increase the quality of the existing infrastructure in a hospital. So this chart is the PDSA chart, and it's something that is implemented in different industries, but we're going to use this for the medical industry or for healthcare. So there's always room for improvement with everything, no matter if it's the education system, if it's the workplace industry. So this chart is some of the basic steps that you can take. So as you can see, the first category is plan. So some of those are some basic bullet points of how you can plan to solve an issue, to solve a problem, or create some sort of solutions, or just improve altogether. So under plan, there's some bullet points. So that's some steps that you can take. After that is the do, where you're actually doing the plan. And then you study the plan. So you go through and you look at the results, you look at the data, how it improved, how it helped, and then you can act. So that's the basic diagram that kind of gives you a start. So I do want to mention that I've been to 18 countries around the world within the last 7 years. I have seen both developing countries and developed countries struggling with their treating people with in the medical industry. So it's really disturbing when I go to third world countries and I see that they're lacking not only the basic infrastructure, but they're lacking some of the basic supplies that they need. I went to Iraq about 3 years ago when ISIS took over Mosul, and when I went to that region, to the Kurdish region of Iraq, I was actually going to some of the medical supply stores, picking up medical supplies and transporting them to the little clinics. And I couldn't believe that these little clinics didn't even have any of the basic stuff. So they didn't have like rubber gloves, they didn't have the basic like thermometers and the blood pressure cuffs or anything. It was really disturbing that even some of the largest hospitals were very, very short on supplies. So it's not only in war-torn areas that there's medical supply shortages or areas that are experiencing major disasters. This is happening in different countries around the world, developing countries that have that just don't have the resources. So I do wish that there was more organizations, both governmental and non-governmental organizations, that would help some of these countries with their medical infrastructure and the supplies that they need. At the same time, going to some of these different areas and being a first responder and covering disasters around the world, I have seen the waste that the medical industry causes. And unfortunately, there's just so much plastic and so much waste in the medical industry. I think that is something that we definitely need to improve on, because there's consequences to all of this, and it causes ecosystem disruptions, just all the plastic. And that's another thing that we could definitely improve on. It doesn't necessarily have to do with the quality improvement of the patients, but it has to do with just our moral obligation to stop using so much plastic and single-use items, if possible, just to help the patient. So some of the other, a couple other points that I just wanted to mention. I wish that they would incorporate healthy food, organic food, whole foods in the healthcare system, in the hospitals, instead of feeding people just processed food. So it gives them a chance to heal, gives their bodies and their immune system a chance to rebuild. And then I'm sure we're going to go into some of these conversations regarding just the expensive costs of the medical treatment in the United States, the bills, the debt, how it ruins people's credit, how people set up GoFundMe's just to pay their medical bills, the financial burden that it causes, and why so many people in America feel the need to actually travel outside of America, to go to Canada, go to Mexico, just to get the prescription medications they need, or just to get the treatment that they need. So obviously we don't have an effective medical system here in the United States. I am a strong supporter of universal health care. I think it would help solve a lot of problems. That's why I was a Bernie Sanders supporter, and so many other developed countries around the world do have universal health care. So those are some of the main topics that we can
Okay.
cover.
Thank you, Dr. William and
Thank you.
Professor Donald. How are you today? Good morning.
Good morning. Good morning, Donald.
Morning.
Good morning. Thank you for joining today's sessions. Actually, today we discuss some important point right now about healthcare systems and these things. So, what's going on in USA? What your advice for developing nations? I want to start from Dr. William, then Professor Donald. Dr. William.
Well, actually, what's going on? Well, in brief, we are about 7 days, 6 days, depending on where you are, before we have a new administration. Washington is currently caught up with the impeachment debate. However, looking past the next 7 days, the Biden administration, as one of their top priorities, at least with domestically, is going to take a fresh look to seek to control prescription drug costs, which is just something that we need to do. Now, that just as an indication would suggest that with regard to developing nations, I mean, it seems to me many of the things that Alex talked about are in fact true. When Alex was citing the lack of supplies with regard to developing nations or third world countries or resource challenged nations, obviously that's a supply chain question, but it's also a question of finances. And so that's two prongs of it, but it's also when developing nations are constructing their supply chain, they would do well to incorporate many of the efficiencies that and not necessarily make the mistakes that we here in the United States have made and have had to kind of overcome and retrofit ours, so that utilizing current technology, they'll be able to more efficiently construct their supply chains, which overall should reduce their costs, not only for importation of drugs, and or access to generic drugs. But more importantly, though, it and we've seen this to an extent with regard to China in other areas, but I think it's an important lesson for developing nations, and that is this: one of the basics, and I know it's a bit of a tangent, but one of the basics disputes between the United States and China with regard to the tariff wars that have been going on has been the basic allegations that the United States has been claiming that China has been stealing American technology and innovation and trade secrets. Well,
Mhm.
at the core of all that is this fight over technology, information transfer, whether it's technology information or biomedical information, but it's a wholesale transfer of information from one country to another. And what I've just with developing nations is that when it comes to the matters, at least in the medical field, when it comes to prescription matters, drugs, if they invest in or seek out ways to obtain the transfer of the prescriptions, that is the basic formulations for the drugs, and they can turn around and increase homegrown production for generic versions of drugs that they will need, obviously in much larger uh, quantities than we will need in the Western, more developed countries. And in that regard, that'll help them save long term. So that might be an initial thing. But I would suggest looking at areas where they can transfer information into and then build their own homegrown industries. Now, India, for one, has been doing this. And we've seen and we've talked about it on the show before, that that's been one of the byproducts of the Oxford AstraZeneca development of the COVID-19 vaccine, whereby they've actually built production facilities in India so that they could actually produce that drug on their own. But it would be those kinds of trends that I would look to see, along with more efficient use of supply chain using current day technologies. Sharif?
Mhm. Mhm. Thank you, thank you, thank you. Professor Donald, I want to share some of the fact from UN. Yes, COVID-19 is a very important factor right now. And beside that, I think that now major thing is we have to distribute vaccine. Vaccine is a major thing. Even I think that many developing nations, they have lot of challenges to getting this vaccine. Beside that, according to, as we are following sustainable development goals, according to the UN, United Nations, we are observing that there is a three issue. Number one, child health care. Number two, maternal health, and HIV or AIDS, malaria, and other disease. It's also increasing. So if we observe the child health cares, we are observing that from 2018, an estimated 6.2 million children and adolescents under the age of 15 years died. So I think we need to more careful about child health cares. Maternals health, over 40% of our all countries have fewer than 10 medical doctors for 10,000 people. This is really, really, really horrible, especially around the
Wow.
world. Over 5% of the countries have fewer than 40 nurses and midwifery personnel per 10,000 people. So I think this is very, very important. I think all of the countries struggle in that point. We have to develop more doctors, more nurses. This is the problem. And third things, like 38 million people globally were living with HIV in 2019. There are more fact and issues, but I want to focus on these 3 points. So Professor Donald, how do you want to share your experience and point of view, especially what there is a major problem? We do not have enough doctors and enough nurses. On the other hand, your wife also a frontliners, and she's also nurses. How can we develop more doctor and nurses for our healthcare system?
Well, it's got, in order to get an education, there has to be a place where you can get educated, and you also have have to have the time and the resources to be able to get educated. So in a country that doesn't have the institutional structures to create training, then it's going to be difficult. So there's a kind of an overall issue about the stability and wealth of a particular country. right now, the a lot of frontline doctors are people that are, to become a physician, it takes, you have to go all the way through regular 4-year college, get into a medical school, go through the medical school for another 4 years, and then do your residency. So it takes maybe at least 12 years of education to be able to become a physician. And the physicians, after 12 years, have spent in the United States, and I'll move this to other countries, but in the United States, the physicians have spent so much money investing into that they, these days, a lot of them can't go into primary care because primary care doesn't pay them enough to be able to pay back the debts that they accrued while they were going to medical school. So they specialize. On the other hand, there's another track, which we call physician assistants and nurse practitioners, which it's actually only a 2-year program, 2 or 3 year program to become a nurse practitioner. And nurse practitioners work under the supervision of a doctor, but very loosely. Like my wife is a nurse practitioner, and she has to, keep careful records and careful charts, and they're looked at by a doctor. And if she has issues, she has doctors that she can go to help. But there's one doctor for lots and lots and lots of nurse practitioners. So what I'm trying to say is that a lot of medical stuff has gotten so routine that it doesn't require that 12 years and enormous amount of debt. So if somebody asked me, I would suggest that it's sort of similar to the barefoot doctor program they had in China, where they trained many tens of millions of people to become doctors, but they didn't have to go all the way through medical school. Nurse practitioners are totally competent. They can prescribe drugs. They really know what they're doing, but there's less resources required for somebody to become like that. So I would suggest that might be a solution to being able to have more people on the front line, being able to help people. But that's just one aspect of it. It's a matter of paying for it. So healthcare systems are paying for it. So that's a whole other issue.
Yes, Dr. William, how do you want to introduce this point? I think that we have a seriously lackings of human resources, especially healthcare system around the world. It's not a problem for USA, not a problem for Malaysia, everywhere. The same problem we are observing. Even though, example, many diseases happening, the capitalizations, business, billion-dollar company, everything moving very fast. But we are, what do you think as a policy analyst, what do you think? We are really caring about our healthcare system? We are really taking care of these things, or what's going on?
Well, actually, no, I don't think that we are really taking care. We really care about our healthcare system. I mean, we've had, we've alluded to this debate on prior shows, and I can tell you the fact that we domestically here in the United States spend $4 trillion on healthcare and don't necessarily get the same qualitative results is an indication that the system is out of sync, and to the extent that there are forces that are based on economic gain rather than either the holistic healing, some of which Alex talked about with regard to organic food when it comes to recovery, and or some other non-drug-based remedies that are proven effective, that are a fraction of the cost. If we were really serious about stuff, then that's what we would be approaching. But there are, it's a statement of truth, a statement of fact, that there are factors and groups out there, vested stakeholders, who don't want to see the system change. That having been said, the challenge is to obviously change that. For developing nations, or those whose system isn't quite calcified as as our American system, the challenge is to find those innovative ways. I had mentioned some programs ago, but I'm going to go back to it this time because it seems appropriate. And that is the story of Erevan from India. And that was, in that particular instance, that case example, because where a doctor sought to perform or produce on a mass scale high quality cataract surgery for a large population that were suffering from it in India. And the way he went about doing it was that he focusing on that particular specialty and then actually trained the doctors who came up through the system, and then made it a highly efficient service that he could provide high quality and low cost service. I mean, his entire story is mandatory reading your first year MBA school, as it was for me. And the point here is that we have to approach it in that direction, because you have to have people that are creative, that are looking at it with understanding that they have limited resources and then growing themselves, rather than somebody from the outside, like say, for example, somebody from the United States trying to superimpose American solutions or structure on a different culture, which may not work. Quite frankly, it ought to be something that works in the culture, utilizing the resources of that culture. Now, in the case of Erevan, one of the natural resources that he had was human capital, and he had plenty of it. So while they did not have massive amounts of technology or medical hardware, they did have an overwhelming abundance of human capital, and utilizing that and then incorporating that into the system, it actually worked, and it's been replicated around the world. So that would be one approach that I would suggest developing nations with. You have to play to your strengths, and unencumbered by a calcified system, developing nations can look to those areas. And I would look at it in those areas. So focus on a specific malady that is paramount importance, and then look for innovative structures to do that in a low cost, high quality way.
Thank you. Thank you. There is one of the specific point right now we are discussing, and we are doing research on the vaccine distribution. So my friends, Mr. Alex, what do you want to add about these vaccine distributions? And this is actually the question for all of our panelists, that how we can create most effective process for vaccine distributions around the world, and what is the inside story of this vaccine distribution. Mr. Alex.
Yes. So first, I apologize. This is not my area of expertise. I don't know if I could fully or confidently answer that question. We did that show on supply distribution. I guess there's a lot of things that we could apply to that. I do want to mention that I do value and appreciate or respect how they are trying to systematically distribute the vaccinations in the most important way. As far as giving the vaccinations to the frontline workers, the doctors, the nurses first. I do know that the people in my region, if you're 75 and older, you're like next in line. I think they are considering distributing the vaccinations to some of the teachers, so that's also important. Anyone that's working directly with the public, that's going to keep them safe. I like how they're dividing it up and not just giving them to the wealthy, the wealthiest people, or the people that can afford them. So I like that approach. I do want to mention that the CDC website has a wide range of knowledge and information. There's a lot of misinformation, like we always talk about in these shows, people spreading misinformation, about Bill Gates or CDC or, World Elite or whatever it is. So I trust the CDC website and the information they're providing to a certain extent. But yeah, with the vaccinations and all of this. So to get up-to-date information, especially in the United States, I would consider visiting the CDC website, doing some keyword searches in Google and finding out some more information. I'm also concerned about, again, that priority with who's getting the vaccinations. I hope that they find a solution or a way to vaccinate some of the homeless people that don't have access to medical, they don't have access to news and information, and they're also out there susceptible, maybe digging through the trash cans looking for recyclables, eating people's leftovers. So some of the most vulnerable people in our community, I hope that they are cared for. and looked out for. So when we are talking about the medical industry, there is some major branches. There's, I think, 6 major branches, and I don't have that information right here, but let's just say like the pharmaceutical is one major branch of the medical industry. Insurance is another aspect, the administration office, and there's the doctors and nurses. So when you're trying to do quality improvement, when you're trying to fix the medical system, you got to look at where there's room for improvement and what you want to focus on. I do want to say that there's so many other options that people are unaware of. I mean, there's I hope I could say this correctly, Ayurvedic medicine, which is just one of the world's oldest medical systems, it says right here. Or there's homeopathic medicines, and there's homeopathic doctors that do different forms of treatment. There's Chinese medicine. So there's all these other options other than Western medicine when it comes to maybe massage therapy, yoga, acupuncture, eating a certain way, diet changes, exercising, lifestyle choice changes. So there's those 3. I would recommend anyone watching this, again, I would try to research homeopathic medicines or whatever, Ayurvedic medicines, and then Chinese
Ayurvedic.
medicine. Ayurvedic. Okay, thank you.
Ayurvedic, yeah.
Ayurvedic. Thank you. Vedic. Okay.
Yeah, there we go.
So those are some of the branches that I'd also recommend studying, because the stronger we are, the stronger our immune systems are, the more resilient we will be, and less susceptible, not just towards the coronavirus or COVID-19, but other potential threats in the future. Also, as we continue to see more pollution around the world, it's just better to have a strong system. So there are so many people that work in the pharmaceutical industry that just care about money. That's why there's such high cost. So we have to realize it's just like the oil industry. They're just trying to make money. They're just trying to profit. There's these companies that are producing a lot of pharmaceuticals. They're raising up the prices. We saw this with the EpiPens a couple years ago, where they had no concern for people's health, their quality of life, their safety. They raised the price as high as they could on those EpiPens, and eventually I think that guy was prosecuted. So we got to remember that that there are other options. So we got to get to the root cause of it. And right now, again, like William was saying, we're out of balance. So we're not eating healthy. We're not living healthy lifestyles here in America. And there's a lot of room for improvement when it comes to that. And I do, again, support the World Health Organization, who I've seen them do a lot of incredible stuff around the world. I do support Doctors Without Borders. They've done a lot of great work helping protect us from Ebola spreading around the world. They're going into remote areas and disasters and developing countries around the world helping. I also support Save the Children and UNICEF and some of these major governmental and non-governmental organizations that are getting into regions with supplies, and specifically medical supplies, to help people that don't have the infrastructure. And those are so a few minutes ago we were saying, well, we need more doctors. So we do, but we need more of all these people. Like, so I'm always saying we need more environmentalists. And like when we have these conversations, we always like need more engineers doing sustainable stuff. We need more people in the solar industry. We need more people creating like green products. We need more people growing organic food. So yeah, there's all these jobs and all these opportunities. We need people for all these good things. So where are we going to get all these people? So I think we just need people doing less things that don't matter, that don't serve a purpose, that are destroying the environment, destroying people's quality of life. They only care about money or capitalism. We need those people to shift their mindset and care more about our society, the future generations of the world, the homeless people, the disabled, and all of that. So we're out of balance, and we need to direct it correctly. So
thank you. We have Dr. Williams and Professor Donald. So what do you want to add, Dr. William?
Well, actually, I think Alex is right. I mean, well, on a number of points. But first, everybody needs more. And the question is, what is the more they're asking for? So, or looking for. So, some people are looking for more profit, and clearly, I agree with Alex that that's not the correct value prop. So I agree with Alex on that. We need more people, but the challenge is that we've got people in developing nations who are just trying to scratch out an existence. or their industries have been decimated, or in any other way, shape, or form. They're just trying to do what everybody else is trying to do, which is live their life, be happy, raise children, and then do meaningful work that earns them a decent wage and a decent living. The challenge for policymakers, for policy analysts, those in my neck of the woods, is how do we, in a forward-thinking manner, create the very conditions that allow these people to achieve those goals while working within industries that provide for a greater benefit. Meaning, how do we shift them, say, from mining coal to servicing wind farms or solar farms or aquatic culture? I mean, that's a challenge for the policy analysts. And on this point, I do want to just kind of branch out for a bit and go in a different direction. And I just want to say this, that for all the viewers out there in the world, hey, listen, nerds are okay, all right? So if you're in school and you're studying a subject and all the other kids are saying that, that they're calling you names because you're not out in the streets playing, I mean, that's all right, because you are eventually going to be a policy analyst, and will be in a position to create a better country for yourself. And so what we need, and here's part of the thing. For a long time, and here's what I want to get to, for a long time, people that were involved in computer codes and things here in the United States, there was a bit of a backlash, and they were calling them nerds and such. However, what they were doing is they were constructing the future. And likewise, studying policy and studying these alternative areas, both of healing, holistic healing, and these other emerging areas, and even in researching medical fields, is the fastest pathway to creating a better world. And in that regard, what we need is, in addition to environmental warriors, we also need policy warriors. That is, people who have a fundamental concern for their neighboring man and woman and children and aunts and uncles and such, who are deeply committed to these areas. And one area is indeed in the medical field. So yeah, you can go and you can contribute by being a doctor if that's what your calling. You can go and, as Donald has indicated, become a physician's assistant. And if that is your calling and that is available to you, then pursue that. If it's nursing, then pursue that. If it's some other area, say research, then pursue that. There are all these emerging areas, all that contribute to a way that will lead to a rewarding lifestyle. And it's for us to be in a position to say, hey, that's okay. So we have to start teaching, talking to the kids and getting it at a very early age, and also getting to the parents, so the parents understand the kids. Now, with that having been said, I want to go back to the graph that you have in front, which is the Operation Warp Speed, and what can this distribution and such, what can we learn from it so far, and how is it developing? Well, briefly, one, what we've already learned that doesn't work. And that is in the race to get to inoculating or providing vaccines for our population on a wide scale. The approach by the Trump administration doesn't work, which is to release a limited, or to say we have a total number of doses, say of 50 million doses. So we're only going to release 25 million doses, and we're going to hold 25 million back for the second dose for the first 25 million. That artificially limited the supply. Now, the Biden administration came in and immediately, as already signaled, and it's now being adopted, said, listen, if we've got 50 million back doses, let's give out 50 million doses and vaccinate 50 million people, because that'll get at least 50 million people half vaccinated while we're waiting for the production for the next 50 million. That it shouldn't be this 25 and then hold back so that we've got that 100% complete group. We ought to be moving all of our, say, medical ammunition to the front line first, and then do it on a mass scale. Now, the importance of that and the lesson for that for the developing nations is that as soon as the vaccines are ready and available and produced, then they should be put to the front lines. That the model and structure for warp speed, if we really want to call it warp speed, it should be the kind of notion that we have when in the private sector they talk about products going straight to market. That is, once it's made, it goes directly to the market. It doesn't go through any of these intermediaries. It's not held off. It's not partitioned off. It's like once you have it, you put it to the front lines because that's where it's needed. Because and Alex was right earlier when he said that it's been opened up to those people 75 and older and provision under the protocols of the CDC of 1A as implemented by each state, but also the various states are now giving it to the frontline workers to include not only doctors, nurses, but they're also talking about teachers,
Grocery stores,
sanitation workers, and police officers, and firefighters, and EMTs. And we can do that because we're pushing all of the vaccines that we currently have produced from whatever source to the front lines, rather than a portion first and then holding in reserve a second portion and then getting that. So the rest of the world, as soon as they come online, the vaccine should be on the front line. And that is one way that we can improve. And it's already a lesson that we've learned, which is one of the benefits of living in a hyperactive, hyperconnected world so far, because in the span of 3 months, we've already learned that lesson. We should not be holding in reserves that which is needed on the front lines. And it's a basic proposition. If I was walking into a war, it would do me no good to hold back 15 tanks if I only had 2 on the front line. Give me all 15 of my tanks up front if you want me to win something. By the same token, put all the vaccines up front. And that is a positive the Biden administration is already going to bring in. They're not even in office yet. So once again, I'm optimistic.
Thank you. Thank you, Professor Donalds.
I'd like to ask Dr. William a question, which is, as a policy analyst, you must follow some journals and some magazines and things like that. I find it fascinating because some of the ones that I follow, we obviously follow different ones, because some of the ones I follow, like Nature, and listening to Dr. Fauci and things like that, the vaccine doesn't really work unless you have 2 doses. So there's some
Oh, okay.
there's some concern that the people that we're actually in a sense wasting it if we give it to people and they can't get their second dose.
Well, actually, Donald, I'm not sure which ones you follow, but some of them have been shown with the studies. Just to be clear, I mean, don't mind me, but they've indicated that the vaccines. I think I forgot which one.
It's 56% effective if you get 1 dose, so it's somewhat effective.
Donald,
yes,
asked me a question, and I just wanted to answer it, and I took a pause.
I'm sorry. I was just helping you because you were, wondering about that. Sorry,
Donald, please. I mean, I'd just like to get through the answer.
Please. I'm sorry.
Okay. I mean, I just don't know why we keep having the problem when you jump in. I appreciate your help, though. I really do. But and just to take off at that point, my point was simply going to be that they did find that partial protection is better than no protection at all. 1, 2, and because of the uncertainties, which when they are ramping up their production, which they're doing very quickly, the thought process is that you get the vaccines that you have out there, which provides the partial protections to the most vulnerable populations, assuming and hoping that the rest of the production will come up. And as you just pointed out, with some of the vaccines, the partial protection is up to 56%. Now, if your point of view, as I hear you saying it under your school of thought, is that don't release the vaccines unless you can provide 100% complete protection to everybody at that instance. And what that does is, under that theory, and it could just be true that there are 2 different schools of thought, Donald, that your school of thought says, okay, well, I have 100 people that need inoculations. I have 50 doses. So I'm going to take 25 people. I'm going to give them 2 doses each. That way I've got 25 people protected, which leaves 75 people not protected. Now, under my school of thought, which people have said, which you just admitted, it provides 56%, at least on one of the vaccines, but it varies. But all of it shows that there is some degree of protection. Under my school of thought, Donald, it says, if I've got 50 doses and I've got 100 people, let me get 50 doses out, because then I know I've got 50 people with partial protection, and then I've only got 50 people with this. And then depending on whether the production catches up, if nothing else, then people that receive the initial doses, it does provide the partial protection, and then I can just redose them as it comes along. But at least I know I've got them protected for a while. So it seems to me that is not a matter of reading different medical journals, Donald. It is rather a question of a school of thought and how you vaccinate the most people to provide immediate protection, which is the need right now, rather than sitting back and waiting for an idealistic world where you can do it all at once when you are offering under your school of thought 75 people up to the vagaries of this disease rather than going for a partial protection of as many people as possible. I happen to have a fundamental disagreement with that school of thought. And my disagreement with that school of thought is not based on the fact that we read different journals. It's a different approach with regard to vaccinating the entire world's population. And on that, I'm not going to apologize. And quite frankly, I think your inference in suggesting that somehow my approach to this problem is flawed or in any other way subject to skepticism, I find that completely repugnant, because what we're doing is we're just having a challenge and a debate of the ideas, Donald.
Hey, I'm really busy. I'm busy. I'm sorry. I'm leaving.
You keep doing that. You've done it over a number of shows. And I really want to put an end to this, Donald. Nobody interrupts you when you stutter, when you pause. Good. I'm glad he's gone.
Okay. Thank you, Mr. Alex. I'm really sorry. So what do you want to add regarding this vaccine-related point?
I do want to add, so I'm 40 years old, you know, half my life has passed. I have had a chance to travel to a lot of countries around the world. I recently had my Google Maps show that I've been to 125 cities in the United States. It showed all the countries that I've been to, all the places. So I have a pretty good perspective of what's going on, you know, around the world, maybe slightly more so than the average person. And I am just sad, and there's just so much suffering in the world, and a lot of it's preventable, a lot of it in the United States. The people that can't take care of themselves, the people that are homeless, the people that are disabled, the people that are crazy, people that once you reach a point where you have an injury or an illness or a chronic disease and you can't function, you can't really go out and try to figure out all the things that it takes to get well. And I've seen that in different places around the world and a lot throughout the United States. So again, I was a supporter of Bernie Sanders and the universal health care and what he was working towards. I think that there should be and there needs to be more solutions when it comes to insurance and just universal healthcare in general. It's just to solve a problem initially. Just it saves so much money if we just would get to the root of the problem. If we'd all eat healthier, or we take care of an injury, a illness, a sickness before it gets worse, before it gets out of hand. I think it would just it would save our country a lot of money, as William has broke down very systematically, and I think it's just the right thing to do. It's just the moral thing to do. I think the vaccination, the distribution, and coronavirus or COVID-19 in general is helping us analyze and reassess the whole medical system and where the flaws are. I have a couple friends that do disaster relief in different countries, and they have set up little medical supply clinics and little clinics. One of them is in Fiji, and they're just figuring it out because in Fiji it used to be where you have to travel X number of miles, get on a boat just to get to it was like a several hour trip just to get to the clinic or to get any healthcare. So healthcare is very important, and as William was mentioning, again, like, how do we train people to transition away from these jobs? Like, how do we train all the people that are in the coal industry to start working in like the solar industry? It's interesting that you ask that. So when I've now seen Bernie Sanders speak, I think like 6 or 7 times, quite a bit. I've shaken his hand 3 times. I've spoke with his wife, and I followed some of his work. So when I went to this area in Northern California when he spoke, it was the main topic was climate change. and it was like a year after the 13 houses burnt down and people died up in the Reading area, Paradise. So he systematically talked about how how his plan was to retrain and educate all of the coal miners about the new technology. So he actually had a whole system in place how he was going to train all of the people to help encourage our transition towards renewable energies, but also so they wouldn't be out of work, they would still have job security. And I guess we just need to see more plans like that, more ambitious politicians working towards those types of solutions. We are going to continue to see the baby boomers here in the United States get older, so there is going to be a lot more jobs and need for home health care aides and nurse assistants and all of that. So there's going to be a lot of job opportunities. This is all listed on the Bureau of Labor Statistics Occupational Outlook website, and and as I've mentioned in other programs, I'm mostly against pharmaceuticals because there's a lot of pharmaceuticals that exist that we just don't need. We can solve with, again, naturopathic medicines, eating healthy, lifestyle changes, just getting away from toxic environments, just going out into nature more, limiting your exposure to chemicals, environmental toxins, off-gassing, just not smoking cigarettes, not doing drugs, drinking less coffee, eating less fatty foods, eating less sugars. I mean, there's so many things that we can do to solve that. There's also the beneficial bacteria in our guts that gets taken over when we eat too much sugar. So just drinking probiotics, kombucha, there's just so many things that we can do that would really improve our health and make us more resilient. Unfortunately, we are in the middle of a pandemic, and again, misinformation really set us back from finding solutions and working towards solutions, and a lot of people suffered tremendously and died because of it. All of the people, well, I don't know if it's safe to say, like 90%, 99, 100, most of all the people that died from this disease, from COVID-19, as you may have read online, they died in a hospital bed, alone, by themselves, scared, confused, and without their family and friends, because no one could get near them because they had a contagious virus. And the people that were treating them were wearing, face masks and goggles and, gowns and a lot of personal protective equipment, which is PPE. These people that had their voices muffled, and so people died really scared in a really horrible way. And so we have the solutions, and we know that we can use technology, we can use specific medications, and this vaccine. And I do trust the vaccines. I would take the vaccine confidently. Again, something else that's slowing us down are all the I really disrespect all the firefighters and some of the first responders that are against the vaccines, and they're not taking it. So there's people offering them, like, it's disgusting. They're offering them gift cards and incentives and free gym memberships and all this stuff so the firefighters will take the vaccines. And if you don't believe me, you could research it. It's just something that this misinformation's reaching our first responders, and again, that's disturbing. And there were some other points I was going to make, but yeah, I'll go ahead and pass it back to William.
Okay,
Yeah,
thank you, Dr. William. Dr. William, as you are policy analyst, so my question is that, like, how we can develop better policy with like good strategy and information and research related informations and evidence for the developing nations. What your advice? What's your guideline specifically for healthcare system?
Okay, there are a couple of different areas where where they can go, and outside of just in terms of the more specific places. Obviously, there are already established reports that the UN has. But what I would do is I would go and I would dust off the original policy proposals back from 1992 under the Clinton administration when they were examining the U.S. healthcare system all prior to us getting involved with eventually what became as Obamacare. Because what it seems to me, the developing nations currently, we have to look at where they're at. And where they're at right now is they have a number of disparate systems. So they've got a mishmash of private and some public, and it's all over the place. And so there was no necessarily organizing structure on them. And that was the exact starting point that the United States began when there was the beginning of the push back in 1992. And although that effort failed, it was then resurrected, obviously, under the Obama administration with Obamacare. But Obamacare was largely based on the initial efforts of the Clinton administration. But more importantly, it was informed by the efforts of Mitt Romney when he was then governor of the state of Massachusetts, when they essentially put in Romney Care. So Obamacare is really a replication of Romney Care. But those policy studies would be the baseline. So that if you were starting from scratch, you don't have to remake the wheel. You go back to what those initial reports held in those three areas. That was 1992 with the Clinton Healthcare Initiative, and then with the healthcare reform under Mitt Romney when he was governor of Massachusetts, and then later the proposals and the analysis and proposals coming from what became the Obamacare back in the early terms of Barack Obama's presidency. That will give you the framework. And what you will find, not surprisingly, is that the analysis, the numbers are going to be different because the people and the populations are different. Obviously, those numbers, basic numbers that drove the policies, are outdated. But you're going to find the same lessons to be true. And that's where I would start if I was overhauling if I was in charge of a developing nation's healthcare system and it was in disarray. I'd start with reading those first and then seeing how applicable those lessons are. And then what I would do as the next step is I would then take a look at the current healthcare system in our nation, the developing nation, and then see what things worked. Because now with Obamacare, we have the hindsight of what has worked and what didn't. And one of the things that has not worked is that not as many young people are enrolled in the system in order to reduce the cost. And what you need is you need like a 90%, 80 to 90% buy-in rate in order to overall reduce all the costs and make the system completely work as a closed providing system. So that is a lesson that we've learned only because it hasn't worked in our system so far, which we're still trying to work on. But that's how I would approach it if I was a developing nation and I was in charge of taking a comprehensive look at the healthcare system and reformulating it for the future. I'd start by reading those old lessons, understand that to the extent that it's applicable to the mass the configuration of the current problem that I have, and then I would begin to look at ways of reforming my system so I can more closely model that. Ultimately, getting to what the ideal plan was, which is either universal health care, because that's the only way that you'll ultimately be able to hold down the costs. That, and then more specifically for governmental officials, when you're out negotiating contracts to buy pharmaceuticals from other nations, one of the key things is you want to stick in that contract. And this is a very specific recommendation. You want to stick in there what's called a quote unquote most favored nation clause. Now, when people went, so that's the industry term to describe essentially this, that if I go and I sign a deal with Alex, and Alex is providing me with COVID-19 vaccinations, and I'm buying it from him at $20 a unit. If Alex then later signs an agreement with you, Dr. Sharif, and provides the same units for $15 a month, if I've got a clause in my contract that says I get the benefit if you ever reduce the price of this drug that you're making to anybody else in the future, I want to get that same benefit. It's called most favored nation. So the minute Alex begins to sell the drug to you for $15, Sharif, even though my contract originally said that I was going to buy $20 per unit, I would then get the benefit of the reduction at $15 per unit. And then depending on the language in the contract, I might even get that retroactively. So then I'd be able to buy more vaccine doses. I mean, the whole point here is to find those ways and implement those ways that you can get the maximum number of doses to then the maximum number of people. And that's why on an earlier show, I was advocating, at least for the developing nations or those the challenge that the Oxford AstraZeneca dose, which comes in at approximately $4 per dose, might be the best way when you have a large population. Dr. Sharif.
Thank you. Thank you. I directly want to go for the concluding remarks for today's. Sorry, some of the interruptions and other things. So, what's the concluding remarks from Mr. Alex for today's sessions? Specifically, how we can improve the healthcare system, what your advice and guideline? And I want to know more from Dr. William about this concluding remarks for today's session.
Okay, so first I would say testing. We haven't mentioned that in this discussion. More testing would be a huge solution. I mean, there's no back tracing as far as, I mean, we're obviously past that point. Initially, when there's a pandemic, you can do testing, look, see someone's signs and symptoms, do testing, find out if they have that disease, and then back trace to find where the source came from, and isolation and quarantine and all of that. So obviously, we're past that point now, but testing would still help. If someone is asymptomatic and they get tested, they find out that they have COVID-19, they would change their plans and lifestyle choices, where they're going to go, what they're going to do, people they're going to see. So it's interesting that I spoke with my aunt a few weeks ago, and she had an opportunity to go somewhere for Thanksgiving. And obviously, you know, we're in a pandemic, you're not supposed to go anywhere. So it was her boyfriend, and there was like a family gathering. She said, no, I don't know those people. It's not in my circle of friends. I'm not going to go. So he kept encouraging my aunt to go. So my aunt said, no, I'm not going to go. You know, I'm 66 years old. She's actually a nurse, and she wasn't going to go to this gathering. So he went to the gathering, and then it was on Thanksgiving. So a few days later, one of the younger girls came down with symptoms. She got tested. She was positive for COVID-19. She immediately alerted my aunt's boyfriend, and then he got tested, and he found it while he was still out of town. So he never actually made it back to see my aunt, but it was that close. It was my aunt that just chose not to go to a gathering. And it's a lot of these situations where it's like people's circle of friends, when they overlap, or with their family or their roommates, and it's just putting other people at risk. So again, vaccinations is a great solution, but also just following some of the basic guidelines and protocols. Staying within your circle of friends, washing your hands, try not to touch your face as much when you're out. Social distancing, only doing stuff that's necessary. We were talking about some of the additional steps, that infographic that I posted on one of the last discussions, where obviously it's a lot more dangerous to travel than it is to go to the park and walk your dog. And you can find that information if you go to Google Images and you search coronavirus or COVID-19 risks, danger. It'll separate all the levels of danger. So we also, in one of the last episodes, and I again want to mention in this episode, so vaccinations are wonderful, but there's also other options that I just mentioned, and taking vitamin D. Right now, the average person is not getting enough vitamin D. There's studies that I think it was like 80% of the people that died from COVID-19 were vitamin D deficient. So incorporating more vitamin D in your diet doesn't hurt. So we don't necessarily get all of our vitamin D from the sun. I mean, I think that could potentially be misleading people, like, oh, I'm in the sun all the time, like I got enough vitamin D. So you actually get a lot of it from fish and oils, or you can take, so if you're eating a lot of fish, then you're probably okay. And you get like less from meat and stuff. But I would also recommend just, getting online and buying some vitamin D, and doing some search of the recommended dosage and how much you should be taking daily. You could also get some blood work done if necessary, or if you're already getting blood work done, if you already have your blood results, and maybe see your vitamin D levels. Zinc is something else that I'd recommend checking. So it did bother me that there was that misinformation, or how they were like the headline of all these news articles, like, doctor that took the COVID-19 vaccination got sick and died. It was just like he took the vaccination and he died from COVID-19. So that's misinformation. So again, like Donald just mentioned, it's 56% effective. You got to take both doses. Like, that's what the information is. That's what we know. For it to be effective, you have to take both doses. Now, again, there's going to be that very, very, very small percentage of people that have adverse effects. but that's nothing in comparison to how many people are dying. I mean, the percentage is so high in some countries around the world. So right now we have the vaccinations that are being distributed. We know that we can take vitamin D and zinc. We know to wash our hands, social distancing, only going out for what we need to, and essential jobs. And of course, stimulus would really help our economy balance and people still be able to buy food and pay their bills. Universal income in different countries around the world are also an important solution. So in the description of this video, I did post a link in the comment section to a really cool video that I watched last night. I definitely recommend it. Like, really, like, watch this video. If you want to learn about healthcare quality improvement, it's an 11-minute video. A lot of people spend a lot of time working to put together this video that's very easy to understand all the steps. You learn about quality improvement. You learn about the PDSA structure, plan, do, study, act, and it's just really easy to understand, and that could be applied to any clinic, any hospital, medical care system around the world. So that video was put together very well. And then I do want to mention, like maybe 4 or 5 years ago, I was traveling to I think I was tornado chasing in Oklahoma. It was fun. So I was on that like couch surfing website, and the person that I stayed with was actually worked in the pharmaceutical industry. I think she was a pharmacist. So she was telling me, like, she's a really sincere, really honest person, really nice. She was telling me how they're constantly trying to take out these people so they try to like wine and dine them. They try to spend money on them. They try to take them to nice restaurants and all this just to push a medicine on them. And that's another really huge concern when it comes to the pharmaceutical industry, that there's a lot of things that we are taking that are prescribed that are not necessary, that we can solve with homeopathic medicines, Ayurvedic medicines, Chinese medicines, eating healthy, and all that stuff that I mentioned. So a lot of times when different doctors and nurses are prescribing or distributing pharmaceuticals around the world, sometimes it is because the system's corrupt, and unfortunately that's just the way things are. So there are a lot of medications and prescription pharmaceuticals that people are dependent on. They need, they're important. There's no other way to solve that disease, that injury, that illness, as far as antibiotics and blood pressure medicine and certain things. But then there's a lot of stuff that we just don't need, and I think that's just good to know. And yeah, that's my concluding remark.
Thank you,
Yeah.
thank you, Dr. William.
I want to echo everything that Alex said, and I only want to do two things. One, with regard to the corruption, the systemic corruption in the pharmaceutical industry, we only need to look to the example of OxyContin, where their salespeople were, through kickbacks and all the items that Alex just mentioned, pushed doctors to overprescribe OxyContin, which led to a pandemic and mental health issues and suicide rates and addiction and things of that nature. And I also, on that point, just historically speaking, all these companies, all these transnational companies do is that when they are caught in the United States and their operations are halted here, these kinds of activities, all they do is they export to the third world. And the prime example of that was that during the trend here in the United States, the rise against the anti-smoking, once the tobacco companies had to admit that smoking was bad for your health, all the tobacco companies did in order to protect their profits was to then promote smoking in third world nations. And so all they did was just shift where they put their products on. And so in this regard, anything that gets kicked out of developed nations, they intentionally try to shift to third world nations. And so for people in third world nations or developing nations, you always have to be mindful of that, whether or not they're prescribing these things in the future, simply because they are shifting known liabilities from developed nations to developing nations, simply because they want to protect their profits. And so that requires an extra degree of vigilance on behalf of health officials in developing nations. I also want to just try to support Alex's notion of continuing to do the basics that we've known. And that is particularly important and takes on an increased urgency for two reasons. One, we're at that stage where we might become lax because there is a vaccine out there, or 4 vaccines or 5 vaccines out there. And so we might just think, oh, well, we can just begin to skip from this because we'll get our vaccines shortly. Well, that's not true. You have to remain ever vigilant now just to maintain status quo. But more importantly, because of the emerging strains that prove to be far more infectious and have a higher spread rate, what Alex often refers to as the R spread rate value. And the point here being that not only do we have the vaccine on the horizon, which provides hope, um, we have to continue to do the same things, washing hands, social distancing, keeping an eye on your insular bubble, but also because you have a much more aggressive strain of the COVID-19 that's out there that can spread quicker. So that's what I have to add. However, I once again just want to remain positive and send. I'm very, very hopeful that in 7 days we'll be able to put a lot of the stuff that's gone on, including the misinformation, the wild accusations, these conspiracy theories that are out there, and that we will begin. It might take a moment or two to get the new government up and running, but we'll begin to see concrete efforts by strategies, by getting things out to people through internet and then international cooperation. And if, like anything else, if we can just hold on for another week, and that's all I would ask, and then and we'll go there. So on that point, I am happy, I am hopeful, and I hope that this is something that some people learn from. Thank you for your time.
Okay, thank you for today's session. Friday we have a session on green technology. So hopefully today's panelists will join, and those who join today's session as a observer, you also can join in the in our session in Friday, and hopefully it will be very much informative and interesting. Thank you. There are some misbehaviors and something happened. I'm really sorry about that, but we are very much like prominent that with World Talent Economy Forums, we are reaching, and we are truly reaching with millions of people, with university, with corporate, with academia, and many more things. Those who will stay with us, they will definitely get a lot of benefits, and those who want to like cannot stay with us, I do not know, but this is our objectives. It's a team effort. We always believe in teamwork, and hopefully those who join with us, they are all everyone is a highly educated, and we can fulfill our requirements. And thank you everyone for joining today's sessions, and I'm really sorry for something happened in between our panelists, but I'm really sorry about that. And hopefully it will be more interesting from the next day. Thank you everyone for joining today's session.